This is Dr. Dustin Hendrix with Chiro MSK Specialists. We're coming back at you with another video. This week, what we're going to be doing is hip pain. So we've already covered neck and low back, and now we're moving into hip. Hip pain can stop your daily routine. It's estimated that chronic hip pain is 30 to 40% in adults who play sports, and that also includes, weekend warriors and things of that nature. And patients who visit our chiropractic office for hip pain usually have the following problems. They have hip or growing pain. And, it's really interesting. We'll talk about this in a little bit. But, your hip is typically considered right here in this area. But, sometimes you'll get a little bit here. Now, when we're going to growing, we're going more into this side as well here. And then the rest is more of, your thigh and your hamstring area. So people with hip pain can also get growing pain that plays into it. The other thing is stinging and referred pain. So you can get a nerve type sensation that's actually coming from the low back that's referring into the hip. Muscle spasms and tightness in the hip is a very common one. It's kind of complicated because even some of your hip flexors start in the low back. So there's a lot of interconnection in play there. You can also get stiffness, limping, swelling. Clicking and locking, we'll talk about that when we get into the labrum tears. Snapping hip syndrome is another thing. Tenderness to touch, hurts to sleep on it, bursitis type stuff as well. If your hip pain is from muscle and skeletal causes, seeking treatment from our office can give you back freedom from your pain. Hip pain responds great to chiropractic muscle work and exercises. And a lot of the stuff that we were talking about, referred pain from the low back, so you can have like a nerve. You can also get like a muscle referral pattern too. Sometimes you'll push like on the QL, one of the muscles in the spine, and it'll shoot down. Acetabular impingement syndromes, those are really fascinating. Let me get my model here. So when you look at your hip, okay, what will happen is you can get called an impingement syndrome. So inside here, there's something that's called a labrum, and it's literally like a flap or a cushion, and it sits on top there. And so what will happen is you can get a spurring in the bone. So it'll basically be like an outgrowth of bone that they call a spur, and that'll actually rub into the labrum inside there. Bursitis. So basically in your body, you have cushions that are also designed for making sure that tendons glide properly and they don't get scrubbed on by bone. Those are typically your bursas. So, they're not like you think with like a disc or something, so they're not a big cushion, it's just a small lubricating pad. So you can get those inflamed, and that's where they call it a bursitis, just inflammation in that. Tendonitis, that's when you actually have a muscle tendon that's getting swelling and inflammation, typically over a long time. Really debated over the tendinosis versus tendonitis type thing. There's a lot going on with that. Sprains and strains of ligaments, muscles of the hips. So, this is different. So a tendonitis is the inflammation or swelling process that's causing pain. This is when you actually have a tear. Now, obviously with a tear, you will get swelling afterwards, but that's more of like a byproduct from it. We talked about the labral tears. IT band syndrome is fascinating because you can actually get pain that's going all the way down to the knee that's coming from the muscles that sit inside this hip capsule here. And there's some studies on that as well too. So frequently asked questions with hip pain and some life hacks too. Foam rolling is phenomenal for it. You can even use a massage gun since those have become common as well. So when you're working on the hip, what you also want to think about is not just getting back here, but you want to think about even in these insertional points. We get a lot of runners with insertional pain, and then you also want to think about the muscles here, which is the TFL. But then the other fascinating thing is you can even get inside the abdomen on one of the hip flexors called the psoas, and even work into that as well too. And of course, the thigh and the hamstring, so your quad muscles play into that as well. So you want to roll out that entire structure, and there's an interplay between the hip and the low back. It's tough when you get into an area like this because there's so many muscle attachments and things like that. But when I actually do IT band, I flank the entire IT band, like every muscle that attaches into it. And that's where we get a lot of results from it. If you're getting pain that's not traditionally kind of thought of the hip, but it's more like the bursitis, or sorry, the ischial tuberosity, so the bone you typically sit on, which is that right there. So you can sit on a donut or a pillow. The cane or the walker temporarily can help sometimes. It just depends on the situation that you're in as well. Obviously, we want to return you back to movement without an assisted device, but sometimes it takes time. We talked a little bit about the hip pain area already. We've talked a little bit about IT band. It's kind of fascinating where you get the knee pain. The most common player is the tensor fasciae lata. They call it the TFL. It's a hip flexor that connects into the IT band. It'll make the IT band really, really tight, and then you'll start to get kind of like scrubbing of the IT band that becomes irritated and inflamed. Releasing a full, TFL, but also the hip rotators, as well as hamstring, calf, and tibia, or tibialis anterior. Going that whole span can help as well. Arthritis, it really depends on what you have going on, because there's over 100 different types of like inflammatory type arthritises. But if it's a wear and tear, we've done a lot of talk and studies about how the arthritis isn't really what we thought it was. The hip pain in the back, it's real fascinating. So there are some theories from experts that they play like a joint by joint model. So basically you start at the ankle, and the ankle should be pretty mobile. The knee should be very stable, and then when you get to the hip should be very mobile, and the low back should be stable. So there's a lot of interplay between the low back, but also the entire kinetic chain. That's why we always do muscle work on the hip complex before we do anything with the back, because they interplay so much, even in our low back pain patients. You can get nerve referral patterns that we talked about, even from muscles too. Sciatica is real fascinating. So your sciatic nerve runs down the back of the leg. You can also get it on the side, like a femoral cup, and you can even get an obturator, obturatica, if you want to call it like that, in the inner thigh as well too. So you could have some hip pain that is part of that referral pattern from the sciatic nerve. So there's a very interesting one called Neuralgia Peristetica. Pregnant people will get this. You'll also see it in police officers who wear belts, or people that have a lot of belt or heavy devices that can kind of impinge the femoral nerve on the lateral aspect. And you'll get this weird like numbness and tingling on the outer aspect of the thigh. So degeneration of the hip, we all have a little bit of wear and tear, osteoarthritis type stuff, not uncommon. Hip impingement syndromes, also known as femoral acetabulars, that's what we were talking about, where it can eventually rub the soft tissue in the labrum as well. And the labral tears kind of play into that, but that's just that cushion that sits over the femur. IT band syndrome, we've talked about that one already a little bit. We see it most commonly in runners. They're already running on tracks or roads that are slightly slanted, and then also there's a lot of improper muscle recruitment patterns, and that lateral line strength, that's what we work on a lot with people. And we've seen really good results just from doing soft tissue of the hip. Even people with things that they thought was like a bursitis can also be some of that junction where those muscles are coming in, like the tenoperiosteal type stuff. So if you guys have any more questions on hips, just let me know. We will also be posting some videos on it. Not sure if we'll do rolling or stretching or rehab yet. We'll figure out which one we feel is best for this one, but we'll get that taken care of. All right, guys, until next time, y'all take care.